Welcome to Nurse Career Blueprint. If you're frustrated by missing NCLEX questions you studied for, you're not alone. You've put in the hours, but your scores are not showing it. The problem is not your knowledge. It's how you apply it under pressure. Today, we'll break down the 6 biggest mistakes that cause students to miss questions they should get right. And more importantly, how to fix them. This is not just another content review. We are focusing on strategy so you can turn frustration into confidence and build the critical thinking skills you need to pass. If you're serious about passing, hit subscribe and turn on notifications for more NCLEX strategies. You've worked hard. Now, let's make it count. Let's get started. Mistake number 1, answering a different question than what's being asked. Under pressure, it's easy to skim and jump to familiar answers, missing crucial keywords like first, priority, or initial. The NCLEX tests your ability to prioritize, not just recall facts. Many answers are technically correct, but only one is the correct for the scenario. The fix is to slow down. Read the question stem twice before looking at the options. Highlight keywords and patient details. Then restate the question in your own words. What is this really asking me to do? This simple pause helps you focus on the true objective and spot the right answer. Do not let anxiety rush you to pass what matters. The NCLEX is full of distractors, answers that sound right but are not. These are designed to test your critical thinking, not just your memory. Distractors might be true statements in the wrong context or safe actions for a different scenario. The solution: use process of elimination. Actively look for reasons to rule out each option unsafe, irrelevant, or delays care. Cross it off. When you're down to 2, compare them side by side. Which one directly addresses the main problem or keyword? Remember, correct information in the wrong context is still wrong. Eliminate the obvious no's. Then choose the best fit for the scenario. Many students treat the NCLEX as a memory test, but it's really about clinical judgment. You need frameworks like ABCs, airway, breathing, circulation, Maslow's hierarchy, and the nursing process, ADPIE. For priority questions, always think, does this threaten airway, breathing, or circulation? If so, that's your answer. If you're unsure, ask, do I need to assess before I act? Write down which framework applies as you practice. Applying these models trains your brain to prioritize like a nurse, not just a student. Frameworks turn knowledge into safe, effective action. Please subscribe for more NCLEX strategies. Overthinking is common, especially if you know a lot. You start imagining rare exceptions or adding details not in the question. The NCLEX is not trying to trick you with obscure cases. It tests safe entry-level practice. Only use the information given. Do not invent what-ifs. Trust your first logical answer. Change it only if you clearly misread the question. Practice predicting the answer before looking at choices. Then match your prediction. Keep it simple. Trust your preparation. Do not jump into answer choices before identifying the question's main topic. Every NCLEX question centers on a core concept: fluid balance, infection control, delegation, etc. If you do not know the problem, you cannot pick the best solution. After reading the stem, pause. What is this question really about? Name the topic in your head. Hypoglycemia, increase intracranial pressure, delegation, and so on. Then ask, for this topic, what's the safest, most effective nursing action? This 2-second step keeps you focused and prevents getting sidetracked by distractors. Most students glance at wrong answers and move on. That's not real review. Every mistake is a chance to improve your thinking, not just your memory. Keep a mistake log. For each wrong answer, write the topic, why your answer was wrong, why the correct answer was right, and which framework you missed. Be specific. Did you miss a keyword? Fall for a distractor? Forget to assess first? Review your log twice a week. This active process rewires your approach and prevents repeat mistakes. Don't waste your errors. Turn them into learning tools. This is how you build a reliable, repeatable system for NCLEX success. Make every mistake count. Do not forget to subscribe. Those are the 6 strategic mistakes that hold students back on the NCLEX. Passing is not just about knowing the content, it is about applying strategy and thinking like the test. Next time you miss a question, ask, which mistake did I make? Use it to sharpen your process. Every corrected error is one less to make on test day. You have the knowledge and now the strategy. Put them together and walk in with confidence. Download your free NCLEX Ultimate Study Guide at nursecareerblueprint.com for more tips and resources. Thanks for watching, keep going, and I'll see you in the next video.